Hello and welcome back. Today I'm going to talk to you about diabetes and nutrition. Mellitus. Diabetes, sometimes called juvenile diabetes. This is autoimmune diabetes where the cells that produce insulin are destroyed by an autoimmune reaction. Your body destroys the cells of the pancreas that make insulin. Type 2 diabetes, on the other hand, or adult onset diabetes, is characterized by failure of the body to respond correctly to insulin, and both result in elevated levels of blood glucose. Diabetes is on the rise. This diagram from the CDC shows that from the 1950s through 2015, there has been a dramatic increase in the percent of people with diabetes, and in fact the number of people with diabetes in the United States, with the current percentages topping 20, 22, 23%. Diabetes is the most common non-communicable disease worldwide. It's the fifth leading cause of death in the United States, and it's cost the medical system over $132 billion a year. This is a very nasty disease. People with body mass indexes of greater than 25, those who are obese with a body mass index of greater than 30 are at very elevated risk of diabetes. Physical inactivity is a risk factor for diabetes. Poor diet is again a risk factor for diabetes. That's generally a diet that is low in fruits and vegetables. Diabetes risk increases with age, family history, high blood pressure, low HDL lipids. Again, this can be associated with low physical activity. High triglyceride levels, that's eating too many fats in the diet. Gestational diabetes is a risk factor for getting diabetes later in life, and certain races and ethnicities are at elevated risk of developing diabetes. So, what are the symptoms of diabetes? As the Romans pointed out, increased urination frequency, excessive thirst, and also increased hunger are three of the key clinical symptoms. This will usually come with a lack of energy, possibly irritability, blurred vision. Unusual weight loss is frequently seen. Infections are common in people who are displaying clinical symptoms of diabetes, and sores are often slow. So what is an oral glucose tolerance test? Here we have an example of a woman who's undergoing an oral glucose tolerance test. She has not eaten for 8 to 12 hours prior to the test, and then she will be asked by her doctor to drink a glucose solution. Then 2 hours later, her blood will be tested to see what her blood glucose levels are like. And here I have what blood glucose levels would look like for a normal person in red, and for a type 2 diabetic person here in green. What you can see, a normal response to ingesting glucose is for the glucose to increase in the blood, and then after about an hour for insulin to be secreted and for the glucose to be stored away in your cells, ready to power your cells, your muscles, and other cells of the body later on. Now, in diabetes, the insulin response is impaired, blood glucose rises to a greater extent. It starts at a higher level, rises to a greater height, and then after 2 hours remains high in a diabetic patient. And this is because the diabetic patient's insulin response is blunted. They're not responding correctly to the insulin that's being secreted from their pancreas, and the blood glucose remains high. This is a problem because this blood glucose here is causing damage. Who should get tested for diabetes? The American Diabetics Association recommends that anyone greater than 45 years old gets tested and has repeat testing every 3 years thereafter. Testing should be done at a younger age by people who have high body mass index, that is, that they're overweight or obese. If there's a family history of diabetes, you should get more regular testing. Certain ethnic populations at high risk should be tested regularly. If you are a woman who had gestational diabetes or an infant that was very, very large at birth, you should also consider getting more regular diabetes tests. As a result of this kind of damage that goes on with blood glucose, diabetes doesn't particularly affect one specific organ, but it causes a lot of changes throughout the body that are degenerative and, frankly, quite nasty. Let's take a look at some of those morbidities associated with mortality in diabetes. First of all, there is elevated coronary atherosclerosis. That's formation of fatty plaques in your blood vessels, the blood vessels of both your heart and in your brain. There are also the same as occurring in your eye, which can lead to retinopathy, which is damage to the blood cells, to the blood vessels in the back of your eye. Kidney function can be compromised for similar reason. And then your nervous system is affected by the glucose and glycation products damaging neurons. One of the additional problems you can get with the atherosclerosis in your periphery, that's blockage of blood vessels in your periphery, is gangrene and cell death in toes and fingers. And very often associated with nerve damage, there's impaired sensations in the legs and the feet. So what does that look like? Here I have a picture of an eye showing retinopathy, where there's damage to these red blood cells. Here is a person who is suffering from a macrovascular blockage. That's a blockage in one of their blood vessels caused by diabetes and atherosclerosis resulting from the damage in their blood vessels caused by the high blood glucose. You can see that this leg is swollen. Here we have gangrene, where a blood vessel was blocked and blood supply was not getting to the toes of this person. And here we have foot ulcers, again, where blood supply and immune responses were inadequate, and most likely there was an inability of this person to feel an infection in their toe, in their foot, with damage to their nervous system. This is very nasty. You definitely do not want to suffer from the effects of advanced diabetes. So how do we manage diabetes? How do people manage diabetes? There are a number of ways that doctors will ask you to manage your diabetes. Amongst them is medical nutrition therapy. Physical activity, it's important to increase physical activity. Blood glucose monitoring is essential to make sure that blood glucose does not reach dangerous levels where it can cause damage to all of your blood vessels and neurons. Medications are prescribed for type 2 diabetes. And self-management and education is critical. People need to be educated to become aware of what they need to do here with medications, blood glucose monitoring, physical activity, medical nutrition therapy. They need to work together with their providers their healthcare providers to manage their diabetes. So here are the specific recommendations. Firstly, you should maintain a healthy weight. People should regularly exercise. 90 to 150 minutes per week is the goal. It is important to maintain blood glucose levels along with lipid levels and blood pressure goals. A DASH diet is highly recommended. I will cover a DASH diet in one of the later lectures. It's important to improve food selection, to reduce dietary fats, especially saturated fats, which can compound the effects of higher glucose to further damage your blood vessels. One of the recommendations is to spread meals throughout the day, to spread the glucose load throughout the day. You still need glucose to feed your cells and to power your cells, but spreading it out throughout the day to maintain a more consistent level of glucose is recommended. And obtaining carbohydrates from fruits, vegetables, whole grains, and legumes, and also dairy products is key. It's important to avoid added sugars in the foods that you eat. Okay, these are the evidence-based recommendations for diet and exercise here. Weight reduction. Desirable weight is body mass index of less than 25. Carbohydrates should make up 50 to 60% of your daily calories. Even with diabetes, it's important to take in sufficient carbohydrates. Some people drop their carbohydrates when they have diabetes. This is a dangerous thing to do because these people generally replace some of the carbohydrate calories with lipids, thereby causing further damage to their cardiovascular system. Polysaccharides from whole grains, legumes, and vegetables are really important. I would also add fruits here. It's important to exercise moderation with sugars. I would say reduce these as much as possible. Some people like to use glycemic index to moderate their sugar intake. I don't find it a particularly useful system, but because it tends to vary from person to person, blood glucose responses. Fiber intake is essential. It's important that people with diabetes intake sufficient daily fiber. On the high end of this range, 25 to 50 grams per day would be a good idea. Protein, it's important not to eat too much protein with diabetes because protein can damage kidneys when taken in excess, particularly when there's additional damage going on from high blood glucose. Keeping saturated fats low, taking in most of your fats from monounsaturated fats, things like olive oil, or polyunsaturated fats, some of the vegetable oils, as well as keeping your cholesterol low is super important. And finally, it's really important to exercise at least 90 to 150 minutes per week. Thanks so much. I hope this has been informative. Look forward to speaking to you again. This is the references and disclaimer page. The reference textbook that most of these videos follow is Understanding Nutrition by the authors Rolfs and Whitney. That's I use the 15th edition by Cengage Publishing. Please subscribe to my YouTube channel. It's called Nutrition, Fast and Fun. There's lots of great videos that you'll find there. And finally, there's a medical disclaimer. You should read the medical disclaimer to make sure you fully understand your rights and responsibilities. Thank you and have a great day. So.